This chapter is going to be on the spine. So as you can see here, this is a CT3D rendition, and we have a thoracic spine fracture. So it's right in here. So let's see if I can draw on here. Let's take a blue pen. So we've got multiples, so right there, and we've got one right here. This looks like a spinal cord injury. Also, these look compressed. So you can see this patient is probably paralyzed, which is pretty sad. So 3D shows us quite a bit, but like I said, we don't normally do it as it's not reimbursed, and it's more for show than anything. So looking here, we have our cervical and we have our thoracic and our lumbar. So we have with our cervical or a lordotic curve, with our thoracic a kyphotic curve, and then a lordotic down in our lumbar, and then we have also our kyphotic curve down here in the sacrum coccyx. So let's review some anatomy. We're going to be reviewing as we go through all the different levels. So we have the vertebral body right in here with our vertebral foramen. We've got our transverse process and our spinous process. Between the body and the transverse process, we have the pedicle and the superior articular process. In between the transverse process and the spinous process, we have the lamina. And from one transverse process all the way around to the second transverse process is our vertebral arch, which is the posterior element. So looking here, we're slicing through. As you can see, this is the sacrum coccyx. So this is 5, 4, 3, 2, 1. So we're going through L5. And looking here, we've got our vertebral body. We've got the pedicle and our transverse processes with our vertebral arch in the back. Here is our spinous process with our lamina and our pedicle. Here's a side view. We've got the body, our vertebral end plate, our superior costal facet. We've got our pedicle and our superior articular process, our transverse process, our spinous process, our inferior articular process. This is our inferior vertebral notch and our inferior costal facet. So looking here, we're cutting through on the left side. So you can see here it's off of mid-sagittal to the left. And this is an MRI, and this looks like a T2. So if we count, this is 5, 4, 3, 2, 1, and this is T12. So if we go around, this is the inferior vertebral notch, and we have the superior vertebral notch, and the superior articular process and the inferior articular process with our vertebral end plates, and that's our disc in the middle. This is our vertebral body, and this is the pedicle right there. So if we're looking at the T-spine, we go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. And within each one of these, we have the intervertebral foramina, which is the opening. We have our facet and demifacets on the vertebral bodies. We have our inferior articular process and our superior articular process with the zygapophyseal joints or facet joints. So within there. If we slice through it at an angle, as you can see here, so we'll post-process a lot of CTs this way, and if we're concerned about any calcifications in the foramina, then we'll go ahead and we'll angle an MRI. So this is C2, and you can see the dens sticking up here. So this is the anterior arch of C1 and the posterior arch. So this is the dens. So 2, 3, 4, 5, and 6. So this person should have scanned through C7, T1. We never stop on these. We always scan all the way through. So we have the inferior vertebral notch. We have the inferior articular process and the superior articular process. So this is the bottom, that is the top. And then in between is the facet joint or zygapophyseal joint. So looking here, we're at L5 at the end plate. So we look here, we can see the annulus fibrosus and the nucleus pulposus, which is the jelly-like material. So the annulus fibrosus is the tough outer skin of the disc, and the nucleus pulposus is the jelly type. And you can see the zygapophyseal joint right there is nice and bright. So this is a axial T2. This is the cona equata within the CSF. So the nerves are kind of free floating there. Here's the superior articular process, the inferior articular process, and in the middle is the zygapophyseal joint. And you can see the spinous process coming out here in the back. So looking here, same, but this is MRI. Actually, this is CT, this is a myelogram. So we have our annulus fibrosis with the nucleus pulposus and with the cauda equina where the nerves are just kind of free floating, your superior articular process, inferior articular process with the zygapophyseal joint in the middle. Here's your spinous process. So this is taking a look at the disc itself. Here's your nucleus or annulus fibrosis with your nucleus pulposus in the middle. And you can see the cauda equina down in the lumbar spine and your lamina here. Here's your epidural space and your cauda equina. So this is where all of the nerves kind of free float. This is where it's coming out, the spinal nerve, out through the facet, the opening, okay? So the dorsal nerve, dorsal root ganglion, okay? So that's a nerve coming out. This is midline. So let's take a look. So here is 5, 4, 3, 2, 1, and T12. So this is a good scan. And you can see the spinal cord within the CSF, and these are just kind of floating down here, okay? So it's a cord, and then you can see it kind of tapers off, and that's where the end of the spinal cord is in the cauda equina, where the nerve roots are just kind of free floating. They're no longer in a cord entrapped, they're just kind of free floating. So we have our vertebral end plates with our nucleus pulposus, and it's this is a T2, so fluid is bright. So the fluid bright in there is good, showing good healthy nucleus. And then you can see our annulus fibrosis, which is the tough outer skin on the outside. So you see here on L5S1, we don't see nice, bright, cushy. So the gel is disintegrated. Now, along the anterior bodies, we have an anterior longitudinal ligament. We also have a posterior longitudinal ligament that helps hold the annulus fibrosis in case they tear. It keeps it all together. This right here is the aorta. It's the thoracic aorta, abdominal aorta coming down into the pelvis. It bifurcates about here so that you see an end. We have a lot of the times caught aneurysms of the aorta on our lumbar spine scans. So looking at the C-spine, we have the anterior arch, the transverse foramen, and that's where your verts run. And here is your transverse process. Here's your lateral mass, your posterior arch, and superior articular process. So you can see how high up we are. And looking here at a CT, this is our anterior arch, this is our lateral mass, our transverse foramen. Here's our posterior arch and our transverse process, and here's your odontoid. So you can see here we're going to be slicing through mid-body. So this is a MRI T1, and you can see this is our odontoid or dens. Here's our lateral mass of C1 on either side, and our atlantoaxial joint on either side. So here's 2, 3, 4, 5, 6. We usually just count 2 down on a C-spine. It's pretty normal for us in CT and MRI. And we don't count spinous processes. We count from the odontoid down. So when you guys do that, I always laugh. I'm like, oh my gosh, what are you counting? So occipital condyle is here. Here's your lateral mass of C1, superior articular process. Here's your intervertebral disc, and they say your eusinate process, but kind of hard to see. Right here is your vertebral artery, right there. Okay, here's your odontoid process or your dens, and we've got your superior articular process on either side. This is your body. This is your inferior articular process and your transverse process. So if we slice through, this is a CT, it's being reformatted into the coronal plane. We have the occipital condyle. Here's your odontoid or your dens. Here's your lateral mass of C1, and this is the body of C2. Eusinate process of C3, and your transverse of C2. And we're going to go midline. So this is a CT also, and like I said before, don't miss that this is the anterior arch of C1 and this is the posterior arch of C1. So this really big piece right here, this is your cross-section midline of C2 with your dens. So here's your dens up here, so your odontoid, and here's C3. Okay, so here's your odontoid. Here's your superior articular process. This is the body of C2 down here. We have the atlantoaxial joint, and we have the superior articular process of C2. This is the posterior arch back here and the spinous process of 2. Here's a CT3D. Looks kind of weird, like it's been cut off right there, so there's some step off. I'm not sure what's going on. Here's your occipital condyle coming onto your lateral mass of C1. Here's your dens or odontoid, and then here's your superior articular process where the 2 meet, okay? And here's 2, 3, and here's 4 down here. So here's another one. Here's your dens or odontoid, superior articular process, your transverse process where your verts run. Pars inter articularis, you have your transverse process coming out here, and your inferior articular process with your spinous process coming off the back. And you can see here we have the body, uncinate process, we have our transverse foramen, we have our pedicle, and our lamina back here. This is our superior articular process, and you have a spinous process that's bifid. Bifid means in 2. So you can see we're cutting through. So this is 1, 2, 3, 4, 5, 6, 7. Let's just make sure 2, 3, 4, 5, 6, 7. So let's take a look and see what we got. All right. So here's the body. This is our intervertebral foramen. And we have our spinous process, and it's bifid. So here's our lamina on either side. So this is a myelogram, so you can see the CSF is nice and bright with contrast, and our cord is in the middle. So here's another axial. So we've got body of C7. Here's our transverse foramina. Here's our transverse process, and here is our spinous process of C7. Okay, we're going midline. So let's take a look at this. This is a sagittal T2, and we run the scan quite a bit, especially when we're scanning to count into, we'll actually open up a little bit bigger when we're doing a T-spine, because we have to be able to count. We need to count usually we count from the top down, but there's times where we count from bottom up. If the C-spine is too fused and it's hard to count, then we'll count from lumbar up. So we'll go L5S1 all the way up. So here, you guys always count the spinous processes, and it throws me off. I can't count them. They're too much, as you can see here. Or I can see the bodies really well. So here's C2, 3, 4, 5, 6, 7. C7, T1, joint space right there. You always have to get that, just like when you're shooting an x-ray, we have to do it in CT MRI also. And then we count T1, 2, 3, 4, 5, 6, 7, 8, 9, and T10. Normally I'd open up this field of view a little bit bigger so that I could get through T12, L1. So I can count all the way down. So I just open up my field of view, recenter, and scan it again so that I was sure to have it all. Makes it easier to count. Okay, so here we are. This is a myelo again. So here's the spinal cord right down the middle. Here's C1. This is the posterior arch. Here's the spinous process of 2, 3, 4, 5, 6, and 7. So they're clipping off a piece of 7. So here's 2. You can tell because it has a little seal nose right there. So I always know that that's my C2. That looks kind of weird right there, like there's a little fracture right there. A little concerned about that, but I don't see any thickening. So anyway, so 2, 3, 4, 5, 6, 7, and T1, but you got to make sure you don't clip off the back. It's just like shooting an x-ray, you can't clip it. So here's your spinal cord, and here is contrasting your subarachnoid space. All right. So looking here at the T-spine, here's your body. We have the costovertebral joint, and we have the costal facet transverse process. So here's a rib, and we've got your transverse process. So the way I remember it, costovertebral, it's by the vertebral body. And then costal facet transverse process. So this is the joint space right down here, and it's down by the transverse process. So by the body, and by the transverse process, okay? So you have your pedicle, your lamina, you have your spinous process, transverse process. So costotransverse and costofacet of the body. So costovertebral joint right here, and we've got the costotransverse down here. So this is a rib right here, and the costofacet transverse process. And we've got the spinous process, your lamina, transverse process. Here's a rib, and right here is your pedicle and costofacet of the body, and here's the body right there. So we're going to be cutting through in a coronal plane. So looking here, it's kind of a cool shot. You can see your spinal cord and your subarachnoid space with the contrast within it. And we've got the pedicle and the rib and subarachnoid space, the thecal sac, conus medullaris. So the conus medullaris is where the spinal cord ends, okay? And then it goes into the cauda equina right after this point. Here's the pedicle. And we've got the costovertebral joint. It's the joint space between the two. And your first rib coming off. So here's a CT3D. So if we look here, these are ribs coming off. So you know that that's T-spine. So we look here, here's the sacrum. And here's L5, 4, 3, 2, 1. Yep, 12. Has a rib. Perfect. So we have the costovertebral joint, we have the transverse process, the sacral prominence, here's the sacrum, and all these holes are the sacral foramina, and there's your coccyx. Here's the sagittal 3D. So here is your sacrum, we have the sacral promontory, L5S1 disc space, here's L5, superior end plate, and you have your disc space there, 4, 3, here's your intervertebral disc space. Here's your pedicle right there, and it goes up to T10. You can see the rib coming off these two, and your intervertebral foramina, transverse process right there, interarticular process in here, superior articular process, and your spinous process is the big pieces coming off the back. All right, so right here is your superior vertebral notch with your superior articular process, and we have your transverse process, pars interarticularis, your spinous process, inferior articular process. So you have your superior vertebral notch and your inferior vertebral notch with the body, and your pedicles right in there. Looking at it straight down, here's your body, your pedicle, your transverse, your superior articular process, spinous process, lamina, and your vertebral foramen, or foramen, either way. Okay, body, superior vertebral notch, inferior vertebral notch with your pedicle, superior articular process, transverse process, pars interarticularis, and your spinous process, inferior articular process. So we're going to be slicing through 5, 4, 3, 2, 1. So body of L1, we have the pedicle, the transverse process, the lamina, the spinous process, and there's where your conoequata will be. So this is at L5. So you can see it's a lot larger, so they get wider as you get lower. So here's the body, here's your pedicle, your transverse process, your lamina, your spinous process, and this is your conus medullaris, and this is CSF in your subarachnoid space. Okay, we're going midline. So this is a sagittal T2, and I know that because the fluid is bright. This is an MRI. So here's sacral body 1 and 2, and there's 3. Here's your thecal sac, and here is your disc space, your nucleus pulposus with your annulus fibrosus anterior. So we have back here, you see this white little triangles right there. So white triangle right there, that is epidural fat. That is normal. So cushions your spinal cord. So coming down, here's your cord, your conus medullaris. You see this little siphon right there where it gets narrow? So this is the end of your spinal cord. Okay, here's the spinous process. We have a supraspinous ligament coming down along. Here's your cauda equina. You can see the nerves just kind of free floating within the thecal sac. Okay. We have a posterior longitudinal ligament that runs right along the bodies on the posterior. We have an anterior longitudinal ligament that runs on the anterior side. Sacrum. So here is the body of the first segment. Here's your ala, that's what I call it, or lateral mass, either one. You have your sacral foramina. You coccyx, you have 4 to 6 depending, so 1 through 5 for your sacrum. So there's 5 different bodies, and your coccyx can have 3 to 5 segments. So looking here, you see our angle. See how sharply angled we are? So we're splaying out the sacrum. So it looks like this. Here's your sacral prominence. Here's your ilium, and we have your sacroiliac joint, so your SI joint. Here's your sacrum. This is your body, and through here and your sacral foramina are each one of these holes. So they did a good job laying that out. So we're going midline again of the sacrum. So if we look here, here's L5. L5, S1, here's your sacral prominence. Here's S1, 2, 3, 4, and 5, and then you have 3 coccyx right there. So this whole section is your sacrum, and this is your coccyx here. And we're going to go down here. So when you see this joint space, your SIs, then you're pretty sure in saying that this is your sacrum. So here's your sacral prominence, here's the body. Here's your ilium, and this is your SI left, and your right SI. Here's your lateral mass and your articular process. Okay, this is a cervical spine, and this is a sagittal T2. Here's your anterior C1, your posterior C1, and I want you to know your posterior longitudinal ligament running along here. It goes all the way down. This is your spinal cord. This is your supraspinatus ligament coming down this black line. Interspinatus ligament, which is in between each spinous process, okay? And CSF in your subarachnoid space right there, so that's fluid. You have your anterior longitudinal ligament, so you can see it right there coming down. It goes all the way down. Here's your odontoid process, so you can see the little seal nose right there. So you know this is 2, 3, 4, 5, 6, 7, T1. Perfect scan. This is your clivus up here. Okay, we're going to do a coronal now. So this is your clivus up here. Here's your occipital condyle. This is your odontoid process. And I want you to know body of C2 and your lateral mass C1. Okay, so this is your odontoid right here, lateral mass of C1 on either side. This is your spinal cord right there, and this is your posterior arch. So this is an MRI T1, so it's kind of funky. Looks weird to you guys, not to me, because I've been looking at them for 15, 20 years. So looking here, here's your anterior longitudinal ligament, and this same thing runs along the back. So you can see it right here, the posterior longitudinal ligament. So that helps hold all the nucleus in place, okay? So you can see the lamina, the transverse process, the intertransverse ligament. So between the transverse processes, so it's between, okay? Ligamentum flavum right here between each body there. And then we've got, what else do I want you to know? Interspinous ligament, supraspinous ligament, and of course vertebral bodies. Okay, so if we're looking here, and we got a cross section, so we have the pedicle, the lamina, ligamentum flavum, and we've got the interspinous ligament, the supraspinous ligament, intervertebral foramina right there. Here's your spinous process. Here's your posterior longitudinal ligament. Here's your anterior longitudinal ligament. This is your vertebral body. And we've got the intervertebral disc, which consists of the annulus fibrosus, which is on the outside, and the nucleus pulposus, which is on the inside, the squishy. And then you've got your vertebral end plates. We're going to go sagittal here. So this is a lumbar. This is sagittal T2. So here is 5, 4, 3, 2, 1. So there's T12. So if we look here, here's our conus medullaris. You can see where it narrows, and then we go to the cauda equina. And we have the supraspinous, the interspinous, and the ligamentum flavum. And then remember, this is epidural fat right here. And then we've got our thecal sac, and filium terminal is where it attaches, okay? So your posterior longitudinal ligament, anterior longitudinal ligament. All right, so here we're going anterior longitudinal ligament, posterior longitudinal ligament, and we've got the ligamentum flavum right here. And I didn't make you know that one. All right. So here's your descending aorta, anterior longitudinal ligament, and we've got our posterior longitudinal ligament. Here is our thoracic spinal cord, and our epidural fat is right back here. We've got our lamina, ligamentum flavum, and our body, of course. Okay, so superior articular process, inferior articular process. We've got right here our posterior longitudinal ligament, and then our supraspinatus ligament, and our spinous process with our ligamentum flavum. We have our anterior longitudinal ligament, posterior longitudinal ligament, the cauda equina, so this tells me I'm down in my lumbar spine. I have epidural fat, you see that bright right there? Our thecal sac, and our ligamentum flava. So looking at the muscles, we have, here is the mastoid process right there, ligamentum nuchae, splenum capitis muscle, and you can see where it's attaching, and you've got here coming around, we have the splenum cervacis muscle, and here's your spinous processes, and that's it. Let's take a look here. Okay, so this is an axial, looking at the C-spine. So here is our cord, okay? Here's our body, here's our cord. So this is our spinous process, transverse process, here's our lamina. So we've got the multifidus muscle, splenius cervacis, and then right here, semispinalis capitis. We have our splenius capitis and our trapezium in the back. I know, it's terrible. It looks like a flower to me. Okay, so here is our multifidus muscle. We've got our splenius capitis, our splenius semispinalis capitis, our splenius capitis, our levator, and our trapezius. Looking here is our cervical body. This is a CT with contrast, so you can see our jugular and carotid. So we have right along, you can see multifidus muscle. So I'm going to have problems with that one. Here's our lamina. Here's our spinous process transverse. Here's our body. Splenius cervacis. So as you can see, it's really hard to see on what these muscles are. Here's our semispinalis. You can see a little fat band in between each. Here's our semispinalis and our trapezius. Okay, so here's them splayed out. So we have, I want you to know down here, our rectus muscles are, just so you can see how they kind of all fit together, okay? Splenius capitis is here. Semispinalis capitis, just looking at the layers, okay? Just a different way to look at it. So they're saying this is T9, okay? So you can see a rib coming off. So you know that you're in T-spine because of the rib. So here's your rector muscle, multifidus muscle. Here's our semispinalis muscle, spinalis muscle, okay? Then we come out to our longissimus muscles, and then we have our iliocostus muscles out here. And when we get to the neck, we'll cover them in more detail than what we're doing right now. So here's our thoracic vertebral body, and you can see that we have the rector right there, multifidus, we have our semispinalis, and our iliocostal muscle. So coming over here, this is our spinalis and our longissimus and our trapezius back here. So trapezius is usually the big one splayed out. Okay, so vertebral body, here's a rib and a rib. So rectus, multifidus, and trapezius coming around the back. Hard to tell the difference between the different ones, so I wouldn't ask you on a CT because it's just too hard to see. So this is laid out. You can see little fat bands in between each muscle group. So there you go. Now, the one thing I did want to show you here is that we have our vertebral prominence with our splenius capitis, and coming down here we have our Semispinalis thoracis, so semispinalis is fine. Levator costrums right here, these little guys. And then we have our quadratus lumborum, okay, and it goes on and attaches to the iliac crest. So if we're looking at the lower, so we have diaphragm coming around, okay? So quadratus lumborum is right here. Your psoas muscles, okay? There's major and minor. So I don't care about the major and minor, just the psoas muscles come down. And here's your iliacus muscle. It's on the inner wing of the ilium. So it makes sense. Pectineus and your tensor fasciae latae right here. Tensor fasciae latae. That's how I have to say it to remember it. Okay, so we have piriformis muscles. We have all kinds of muscles. Here's the crest of the diaphragms. And when we get to the thoracic, we'll cover those. You don't need to know those quite yet. Okay, so we're down into the lumbar spine. So we have the psoas muscles down here. We have the quadratus lumborum coming across here. This is the transverse spinal muscle, the erector spinae muscle. And I want you to know the latissimus dorsi. Okay, and then out here on the sides, we have the transverse abdominals. We have internal and external, and then the transverse. Okay, so looking here, this is a coronal of the T1. We have the quadratus lumborum, and we have the iliacus here. So spinous processes, and here's your SI joints on either side. All right, so psoas muscles on either side. So there's the minor and the major. We have the quadratus lumborum, and then we're looking here, multifidus muscle and the iliacostus muscle right here. And here is the longissimus muscle. So here is a CT. So here's our psoas muscle on either side. Here's your multifidus and your longissimus muscle and your iliacostal with your quadratus lumborum right there. All right, so looking here, I wanted to show you the brachial plexus, okay? So we have a sacral plexus also. Important that you see where it comes out. Here is your epidural space, okay? So your spinal cord is right here. So your conus medullaris, you can see where the spinal cord ends, and there's this filum terminal that attaches to your coccyx. So people, when they break their coccyx, it's very, very painful because this is pulling on it, which is holding your spinal cord down. So you got to be very careful. So your conus medullaris is where it ends. Then you have your thecal sac and your subarachnoid space, and all your nerves are just free floating within that, okay? But you can see you have your epidural space, and you come down your cord to your conus medullaris, okay? And then you have this filum terminal that attaches down along your coccyx. Okay, we're going to go sagittal. So this is a sagittal T2. We have 5, 4, 3, 2, 1, 12, 11, 10, 9, 8, 7, 6, 5, 4. So close, almost got it all. So you can see here the thecal sac, and then we have the conus medullaris right here, and the cauda equina is coming down. So these are just the nerves kind of free floating, and your filament terminal you can see coming down, just that white stripe or the gray stripe right there, and then CSF in your subarachnoid space. Okay, looking here, we have the body, of course. We have the central canal right here, and this is within the spinal cord, okay? So you have gray matter here, and this right in here is your white matter. So you have white matter, gray matter, okay? You have your ventral root and your dorsal root, and they join together for the dorsal root ganglion. So ventral, dorsal, join together for your dorsal root ganglion. All right. You have spinal meninges, you have your dural, arachnoid, and pia. So your different layers right here. You have, what do I want you to know? You have your epidural, your epidural space, which is filled with fat. You have your subarachnoid space, which is right around here. I want you to know your, this is your spinal nerve, your dorsal horn, and your ventral horn. So in your gray matter, you have a ventral horn and a dorsal horn. You have a ventral root and a dorsal root. They go together to give you the dorsal root ganglion, which is your spinal nerves, okay? So, looking here, vertebral body, here's your spinal cord, and you can see your dorsal root right there. Two of them, little teeny stripes, those little stripes within the fluid. So this is a myelogram. This is your conus medullaris. You can see where it comes to a cone. You've got your pedicle, your cauda equina. You can see all the nerves just kind of free floating in there, okay? Here's your sacrum right there. All right, so here's cauda equina. So you see your conus medullaris, and then it just kind of free floats. You can see your dorsal root coming out right there, ganglion. You got one on each side. You can see your dorsal root coming out. Pretty cool. So aorta, inferior vena cava, and you can see your ventral root and your dorsal root with your conus medullaris in the middle. Kind of cool. All right, so this is a CT myelogram. You can see your conus medullaris right there, that little stripe. Well, right up here is your ventral root and your dorsal root, an epidural fat around the back. This is a good one for your epidural fat. So all this right here is your epidural fat, and you can see your cauda equina and your thecal sac. And here, cauda equina. And so you know it's cauda equina because it's not in a round contained area, okay? Here's your thecal sac, and you have a basovertebral vein right here, and you can see the contrast within the CSF. Here is your ventral root, your dorsal root with your conus medullaris. All right, so you can see your dorsal root and your ventral root, and they join together. Okay, so this is what it looks like from a cross section. So we have your spinous process, intervertebral foramina, and we've got your pedicle right here, and here's your vertebral body with your disc. Okay, so superior articular process, and you have your intervertebral foramina, so where these dotted circles are, and then you have your dorsal root ganglion. Here's your pedicle, and here's the body of L4. Taking a look here, you have your arachnoid matter, dura mater, and your vertebral body. Here's your pedicle, here's your dorsal nerve root, and your spinal nerve coming down. Intervertebral disc, you got your spinal cord, your dorsal root ganglion, your ventral root, dorsal root, pia mater, and subarachnoid space. All right, so here, this is a good shot, great shot. So this is MRI, and it's a T2. It's kind of a fancy T2, but you know, here's your psoas muscles, and this is coming down, and you can see your dorsal roots coming down and out, so to your spinal nerves. Pretty cool, huh? So great shot. Here's your sacrum, your sacral nerve, your thecal sac. Here's a little bit of epidural fat back there. Here's your SI joints on either side. Okay, so this is just giving you an idea where the nerves are going to be associated with pain on patients. Looking here, here's the body, and you have your gray matter, your white matter. Here's your ventral root, your dorsal root come together for your spinal nerve, okay? So you have your brachial plexus, you have a lumbar plexus, and a lumbar sacral plexus. Excuse me. All right, so here's your spinal cord coming down, and you've got your cervical plexus right here, sternoclenoid mastoid muscle, and you're going to learn all about this muscle. It wraps around the back to the front. And here's your middle scalene, here's your subclavian artery, and your brachial plexus. You can see it coming out right here. So we usually scan from like C2, 3 through C5, 6 typically to get the brachial plexus, and we'll scan out through the armpit typically. So we can see here's the spinal cord, and we've got all of the nerves coming out. So you can see the brachial plexus right here where they're all coming out. Pretty cool. Okay, so looking here, so C4, 5, 6, 7, C8, I like that. T1, so right in here, we're going to watch it go all the way through to the armpit, and see if there's any impingement within the spinal nerves coming out. So you can see them all right here coming out. So here's where the main tracks are coming out. So this is a great job. This is brachial plexus. So we're looking to make sure that there's nothing pinching on any of these nerves coming down and out. So they come from right here to here. So 2, 3, 4, 5, 6, 7. So we usually scan just a block right in through here and we watch it go all the way out. They did a great job. Okay, so here is your lumbar plexus and your sacral plexus. So you can see all of the nerves coming out there and through L1 through L5. You have a sciatic nerve, is the largest nerve in the body, so it comes down. Any impingement of this sciatic nerve causes a lot of pain and burning, and a lot of patients have back pain. That's where it shows itself. All right, or hip pain. They'll have hip pain that doesn't go away. So here is your SI joints, your ilium, your sacrum, and coming down. We're going to cover these muscles later, not yet, but you can see the sacral plexus coming down. So this is a great job also. So we're following this nerve to make sure. You can see it goes right by the hip. So a lot of patients have that hip pain. All right. So looking here, we're going to cover this when we get down into the pelvis and into the upper extremity or lower extremity. But this sciatic nerve runs right here. So this is a piece of it right along the gluteus maximus. Okay, so it kind of wraps around. Okay, the main thing about this, and the slide prior shows this, is the anterior spinal artery. So there's an artery right here. So, and then there's a vein right in here. Okay. So you can see right here the intercostal artery right here. So when they're doing thoracentesis, we got to make sure we don't hit that intercostal artery. And here's the aorta, and you've got your lumbar segments coming off to feed the lumbar. Okay, so the posterior portion. That was a good shot of it. So first time I saw this, I thought they had a fracture. So this is an MRI axial T2, and it wasn't. It was just the basovertebral veins. So they're feeding the vertebral body. The radiologist laughed at me, as they normally do. So here's the psoas muscle, and you have your transverse muscle right here is your thecal sac and your cauda equina. So that's all of them. We covered the spine pretty quick. There's 150 slides, so I'm sorry if I went really fast. We did it in under 45 minutes, so that was the goal. A lot of it is anatomy review, but looking at it within CT and MRI is a little bit different. So make sure you study and you know your anatomy and try to visualize it in the sagittal, coronal, and axial planes. Good job.